All right, welcome back. Thank you so much for staying with us. Being a Thursday, I want us to shift gears and talk matters health. We are looking at kidney failure. This is a silent struggle and a silent killer. And we'll be finding out why they're calling kidney failure a silent killer in a short while. My guest is already in studio. But just a brief history. In Kenya, millions of people have some form of kidney disease. Estimates range from about 4 to 5 million Kenyans living with chronic kidney disease, that is CKD. But for clarity, Dr. Victor Ngani
is correct.
All right, Dr. Victor Ngani is already in the studio with us to talk to us about kidney failure and to teach us more about kidney, how you can protect yourself and what you need to do and what you need not to do. Dr. Ngani is a medical director, Dr. Rasik Kantaria, Jalaram Medical Services. Karibu sana and Happy New Year.
To you as well. Thank you very much.
You know, I'm saying today it's still December. So today we have 2 days remaining until we call the year up. So we start the year officially in February.
2026 is different. So I think for this year, January has just gone like that.
Yes.
So we'll say Happy New Year until the end of February.
Absolutely. So let's get right into it. What exactly is kidney failure?
Good question. First and foremost, the kidneys are some of the most underrated, things you have in your body. Your kidneys are super filters. Your body is busy working. You may not feel it or see it, but your body is busy working, doing lots of things, making sure your brain is working, your hands, and all these things, all these processes, they produce waste. The second thing is that you need certain electrolytes, things like potassium, calcium, calcium to build your bones, potassium. There are certain exchanges in your heart. These levels must be maintained. The kidney is responsible for all these things. Number one, it removes waste products. The urea that comes out of protein breakdown, excess toxins, you've taken some medication, all these things are being washed out. At the same time, they produce hormones. Hormones like renin that controls your blood pressure. It controls hormones that would strengthen, produce red blood cells, erythropoietin and things like this. And many other functions that the kidneys have. Now, for your kidney to work effectively, it has small filters called, the name is not important, but very tiny filters. And they're between 1 million and 1.5 million for every individual. And these guys put out 180 liters of fluid every single day, 180 liters. Now, that's several times over your total blood volume. Now, over time, for different reasons, you can begin to lose these filters. From 1 million, you drop maybe to 700,000. And the process of losing this to a point where your kidneys can't function, this is what is kidney damage in general. So losing the function of the kidneys, that is what kidney failure is. Now, there is a range. You can have just a small impact, and you can lose function all the way to less than 15%, which we then call end-stage kidney disease. Again, I must say that there are two types of kidney failure here.
Yeah.
There is...
In Kenya?
Well, generally, what we call acute, where the kidneys fail suddenly over a matter of hours to days. And then chronic, which is normally the main subject of conversation, where over a period of 3 months or even longer, then the kidney gets damaged pole. But I know we'll discuss this as we go along.
Right, absolutely.
In summary, it's just the process where the kidneys lose their function because of whatever damage there is.
So when you talk about kidney failure, how is the data looking like in Kenya? And I say that it ranges from about 4 million to 5 million who, have kidney disease, kidney failure. But in terms of things like dialysis as well, how are the statistics looking like? Yeah,
you've done pretty good research, actually. I was quite
Absolutely.
impressed. Point. So kidney failure has this thing called the 90% rule. And about 10% of the population, 10% of the population generally has kidney failure globally and also in Kenya. So you see the 5 million approximate 4 to 5 is just slightly below 10% of our population. Now these are people who have some form of kidney disease, not necessarily end stage where they need dialysis. And there's a whole spectrum. We categorize chronic kidney disease into 5. The first one where they retain 90% of the function. Then there's 2, 3, 4, and then 5 where they're in end-stage kidney disease where they need dialysis. So we estimate that approximately 12,000 people may need dialysis today. Unfortunately, only about 5,000 or 6,000 actually have access to dialysis as a result of this, for many reasons. But those are the stats in Kenya today.
But when you say some people have a form of kidney disease, what do you mean exactly? Does it mean that even me or you, as you're seated here, that we might be having some form of kidney disease?
Absolutely. And I said 90-10 because the 90% is also another important statistic in kidney failure. 90% of people who have some form of kidney disease or kidney damage don't know they have it. 90%. And this is because your body is wonderfully made. It has capacity to accommodate a lot of damage. So let's say you can lose up to 50% of your kidney function, and the remaining 50% will work twice as hard. They're hard workers, and you'll not feel a thing. And you know, the other factors as well, you normally don't go for regular checkups. And then kidney disease, chronic kidney disease in particular, the symptoms won't start until more like 10 years after. And there are small symptoms that you may confuse for something else. You just feel a little bit tired, you know, those kinds of symptoms. So most people don't know that they have kidney disease. And it may take a bit of time before they get there. I may surprise you that even for those patients who have clinically significant kidney disease, meaning that their bodies is not able to accommodate the loss of function, they cannot compensate. Compensation is when you take up the role that's been left by the damaged cells and so on. Up to half of them still don't know.
All right, half of the people don't know that they have kidney disease.
Clinically significant. 90% don't know in general, but for about half of those people, the kidney damage is not such that they need direct intervention at that particular moment.
All right.
But those who need clinical intervention from doctors, half of them still don't know they need it.
All right, you already hinted about the signs and symptoms, but we'll be getting deeper into it. We have a caller from Kawangware. Purity, good morning.
Morning.
Talk to us.
Just watching the show and loving the show. I just had a question.
Yes.
In terms of water intake, tunaambiwangwa to protect your kidneys, you have to be careful with intake of water. And just a concern, how much is too much? Because kuna watu wengine wanatuambia take 12 liters a day, mwingine anasema just 7, mwingine 1. So what is it?
Thank you so much, Purity, for that question. And that's a very good question, because I actually saw another concern that does water affect the kidneys in any way or other if Sam takes more water in the night and he goes to sleep immediately? I think it's tied to that question that Purity is asking.
Okay, so I'll separate the two questions to some degree because you need to take some amount of water, significant amount of water to maintain kidney function. In fact, one of the causes of kidney failure is reduced water intake, where you get dehydrated and then there's a bit of shutdown. The kidneys can get damaged within hours if you have decreased blood volume. So you really want to take a bit of water. The general guideline from doctors has been about 8 glasses or approximately 2 liters of fluid in a given day. And too much of something is dangerous as well. And this is to protect your kidney. However, kidney disease is different because someone on end-stage renal disease then cannot take as much water. When you're talking about eating healthy, preventing kidney disease, preventing progression, then you must maintain adequate volumes of fluid. But once you get to dialysis, the equation changes. And we'll see this even in diet as we speak about it later.
All right. Thank you so much once again, Purity, for that question. But now when we're looking at signs and symptoms, we say this is a silent killer, and some may go 10 years without actually realizing that they have, say, symptoms of or an acute kidney disease, right? So what are the signs and symptoms to watch out for?
Yes, I'm sorry, for Purity, I forgot to mention the second part, where if you drink water and go to sleep immediately, then you can get kidney disease. Goodness, the internet has become that's a scam.
That's a myth.
That's a myth. That one is, and I see lots of experts on the internet now telling you, please drink warm water or don't take, you know, those kinds of things. Please ignore those. Just have a chat with your doctor. There, some of these are generated by, the internet has no age limit, right? So you can find a 10-year-old has generated something. So please pay attention. There's no harm. Just drink water, adequate amounts. Talk to your doctor if you're not sure. Now, to signs and symptoms. The bulk of kidney disease will not have symptoms. And I'm talking here largely about chronic kidney disease because acute is quite dramatic. When you have slow progression into kidney disease, then the body can adjust. And as I've said, you can lose half your kidney function and the rest of the body just picks up from there. In fact, you can lose one kidney, which we often do in kidney transplants, take out one kidney and give the other person, they stay with one kidney and, takes up normal function and they live a perfect life. But then later on, then when the disease is advanced, normally stage 4 and 5, 1 to 3, maybe you'll not feel a thing. Then small symptoms like you begin to have nausea, vomiting, you feel muscle cramps, you feel tired most of the time. Those are some of the milder symptoms. Then later on, you may find because your body is not able to handle fluid adequately, then you begin to have swelling of the feet, swelling of the face. When you wake up in the morning, you may have some grainy, white, powdery things on your face, and so on. And surprisingly, one of the earliest symptoms of kidney disease is too much urine at night, the same like diabetes. So you pass a lot of urine in the night. So too much urine and too little urine, both of these can be symptoms of kidney disease. Now remember that when I speak about nausea, vomiting, cramping, these symptoms don't necessarily mean that you have kidney disease. These can be symptoms for many other things as well. In fact, you can just be stressed and depressed, and other illnesses can. So you have to have all these things checked. Don't just Google the symptoms and say, okay, fine. Dr. Victor said, if I have this, I have kidney disease. No, there are other factors you have to do to check this.
Because they could actually just look similar, because too much urine and then too little is also a cause for alarm.
Exactly. Actually, too much and too little cause for alarm any day, and especially because we've not spoken about risk factors. I know we'll get to that.
Yes.
Diabetes is the biggest, and one of the things you'll see in diabetes, even when your kidneys are fine, is that you'll pass too much urine, especially at night.
Just hold on to that point. Let's hear from our next caller. Is it John or Jane? John from Kisii. John, good morning.
Good morning.
Yes, speak to us.
Nilikuwa nataka kuuliza. Niko na mtoto wa miaka 7. Ako na shida ya kidney, alikuwa na susuma kojoa yako careless. Alafu nikampeleka sasa Osia, nikasikia kuna kidney moja.
Yes.
Nikampeleka hata kakani, wakanipima wakasema eti kidney yake sasa 94% ndio iko, ingine 4% haifanyi kazi. So akona kidney moja sasa. Hiyo mtoto nataka kujua vile nitammaintain, kwa sababu nimempeleka Osia, nimeambiwa nimnunulie madawa ya madini. So nataka daktari ani-advise vile nitachunga huyo mtoto.
All right. Asante sana John kwa hilo swali. Daktari.
Yes, thank you, John. And it's something that people often underestimate. Children actually also have kidney failure. And for children, the main cause is actually congenital. Congenital means things that they're born with. And that's a very good example where there's only one kidney that has been, that's the child was born with. And there are many other factors as well. Secondly, you have something called nephrotic syndrome. The kidneys begin to pass lots of proteins and a number of childhood infections. Now, every child will walk a different path. You may be born with one kidney, but the function is okay. You may be born with one kidney, but the function requires other things to be addressed. And there's no one size fits all for this child. What I would recommend very early is to have pediatric kidney specialist. I'm glad actually just yesterday we got our pediatric nephrology, that kidney specialist team in place at our facility. So see a specialist, and the specialist is going to guide on the precise steps for your child, because we do not have one size for everybody. It depends on many factors for the child. So John, my recommendation, na ni vizuri umegundua mapema, kwa sababu sasa utaweza kufuatilia utaratibu pamoja na daktari wa kijana wako.
Speaking of causes, you said, for example, for kids, it has to do with nephrotic symptoms and, of course, congenital, disorders and issues, right?
Yes, yes.
But looking at adults, right? What causes now kidney failure?
Yeah, so causes, I'll probably speak in terms of risk factors. Okay, causes a little bit like this, definitely causes this. The biggest risk factor is diabetes. That's the biggest by far. Second to that is hypertension. So, for example, in diabetes, too much sugar will then connect with your proteins and then just cause damage to your cells. Uncontrolled high blood pressure, that's a big risk and actually a big cause of kidney failure. The second group of items that I would put as very common are things that we do routinely, like you have a bit of pain. I've seen there's a big meme in Kenya now, pewa brufen.
Kunya Brufen.
Kunya Brufen. You're feeling sad, take Brufen, you know. And those are called NSAIDs, non-steroidal anti-inflammatory drugs, and they're very dangerous. These over-the-counter painkillers, you take them continuously and routinely, they can cause ulcers and also affect your kidney. We have imbalances in terms of fluid and especially dehydration. When your fluid level goes down, either through acutely you've lost blood, these are all possible causes. Infections that affect the kidney, anything that causes blood to break down in excess. In children, something like malaria, for example, breaks lots of blood cells, it goes in and clogs the kidneys. All these are possible causes. There are things that result from obstruction. Say that the pathway, the ureter is blocked. So maybe kidney stones, or there's whatever reason, it causes obstruction and causes the kidney to swell. That kidney will lose its function over time. In terms of risk factors, then smoking. Smoking has never made sense. I think because the results come after many years, people don't realize it's causative, but smoking is harmful. So don't smoke. I say that every time I come here. Excessive alcohol is a big risk factor. Sedentary lifestyle. Our diet, especially if you take high protein diet, high sugar diet, all these factors can contribute significantly. I see you're smelling. I hope you're not in any of those categories.
No.
Yeah, and if you have excess obesity, excess weight, your central, obesity is a factor. All these are factors that, and especially now in this generation of junk food, these factors do contribute heavily to the development of kidney disease. Then there are other toxins and poisons that are available in many other things that we take. So be very careful about, for example, for the ladies, what you apply, what you consume. Make sure it's well regulated, not something cheap coming from a backstreet factory in Asia, for example.
All right, before we pick this next call, you mentioned smoking is something of concern and you don't understand it. Then smoking what exactly? Because a lot of people would want clarity on that. Yeah. But let's get this call. Collins, good morning.
Hello?
Yes, good morning.
Morning to you.
Talk to us.
I want to ask, what are the major causes of kidney failure to older people?
To other people? Dr. was just addressing that.
Older people. Like now I'm about 60.
All right.
And you might find I go to urinate all the time, and yet I don't use sugar.
Okay.
What happens?
All right, thank you so much for that.
I didn't get his question.
What are other causes of kidney failure to older people?
Older people, okay. It's just
you say it's 60 years.
Yeah, so that's what I was describing. For example, the risk factors, if you just lead a healthy lifestyle, you have a good chance of preventing kidney failure. There are things you cannot control. For example, as you grow older with age, then your nephrons will die, those small filters I spoke about. This is natural, you can't change that. The other risk factors that you really can't change, for example, if your family has history of kidney disease, what are called autoimmune disorders, if you get something like lupus, all those things, you cannot really do anything about them. But the things that you can change are things like your diet, your lifestyle, what you consume, and whether you drink water, your habits that you can address, exercise, consumption of water, and so on. So those are factors that you want to pay attention to and address, because those you can change.
So for kidney as well, the genetic predisposition can also play a factor as to, how somebody could get affected with kidney disease in future.
Definitely.
Right.
Yeah.
This issue of smoking, when you say smoking, is it bang? Is it marijuana? Is marijuana and bang the same thing? Bang, marijuana, cigars, what exactly?
Okay, so my approach to this is fairly pedantic now. I think I'm almost getting to a point of being rigid. I just say, I don't see what you should be smoking that will be good for you. Yeah, and I think studies have shown some are far worse than others, and some are less, you'll go to the internet again and find that smoking this is good for you, this is herbal, this is medicinal, this is African. But in general, the excuses for it are very limited. So I'm probably a very strong advocate of do not smoke. What do you want to add there? Even if you're smoking magazines you've cut, don't smoke. That's my guide to, that's my recommendation. Yes.
All right, najua umegusa wengi, but
najua, I'm wearing a helmet. I'm glad I'm next to you, you'll protect me. So nobody's...
Absolutely. When you mentioned swelling as one of the symptoms for kidney disease, and why does it happen? Because we have a lot of people, for example, who have swelling of their legs, if they sit down for so long, if they're traveling longer distances, and then, nguinafura too.
Yeah.
Then why does this happen as a sign for kidney failure?
Two things that the kidney does that affect this. Number one, the kidney regulates the amount of water in your body. So it sort of has very many sensors. It feels that there's too much fluid, so it removes excess. The second thing is something called the proteins. So the kidneys are very good at regulating your proteins. So if you remember those things called osmosis, where the water will move to a place where you have a lot of solutes. So in the body, the solute is protein. Where the protein is, the fluid is going to go also. So the kidneys, they lose function. When they lose function, then they can't regulate the amount of fluid. So fluid gets retained in the body. That is one way, and as a result, you get a bit of swelling. So edema, that swelling is just fluid. Secondly, if the protein is not regulated appropriately, then you can have that accumulating in some areas and then causing swelling. But mainly it's fluid, because especially later in life, because your body is not able to address the protein, you actually lose protein and your proteins become less in some instances. So in those two ways, mainly the fluid being dysregulated, then the fluid is accumulating, and that's what you see as swelling in the limbs.
Let's get into the types now in depth. You mentioned acute kidney disease, and of course the CDK, chronic
CKD, yes.
CKD,
yes,
chronic kidney disease, right? So how do they differ in just the way they play out? You said, for acute, it can be a little bit dramatic, but if we go in depth, are they only two types, the acute and CKD, and how do they present themselves differently?
There are multiple. Doctors will break them down, but the most important ones is to look at acute and chronic. Then chronic has 5 stages. So that's what we are going to get into. So acute is something that happens within hours and days, normally less than 48 hours. And what happens is that you have a sudden loss of function. Normally, there's an event that is almost catastrophic, and you'll find it something like dehydration. Someone was in an accident, and they've lost a lot of blood, so the kidneys have been affected, or they have something like cholera, but they are a very good example where you lose a lot of fluid suddenly, then you get dehydration and your kidneys shut down. Then, or some toxin that you've taken, some poison or some serious infection that overwhelms your kidneys. Or a common cause you don't speak about is ischemia. Ischemia is when the body lacks oxygen and the kidneys lack oxygen as well. So these kinds of things can cause sudden deterioration in kidney function, trauma to the kidneys. All those things can cause sudden kidney function loss. That's acute. And acute requires immediate action because it can be quickly fatal. You see, the kidney is responsible for regulating all these electrolytes, things like potassium. And potassium, when you're doing open heart surgery, you give potassium to stop the heart. So if that value goes up beyond a certain level, then your heart will probably shut down. The kidneys are important in maintaining acid-base balance, and your body wants to work in a very narrow range of pH between 7.35, 7.45. So if the kidneys are not working very well, often you get into acidosis, and that can be fatal within hours as well. So acute kidney injury has serious ramifications. It must be addressed. Fortunately, it's often success. I mean, you can reverse it most of the time. Chronic, on the other hand, is different.
Before you get into that chronic, so you mean something as small as an accident, say, a head-on collision somewhere, and then, people are hurt and all that, that can cause a kidney failure?
Exactly, and especially the mechanism I'm referring to here, they're twofold. One, you bleed a lot. When you bleed a lot, then blood flow to the kidneys goes down, and you're going to have some kidney shutdown at some point. And secondly, you can have direct trauma to the kidneys that can result in, those are all possible causes. I don't want to scare anybody, but we've had cases where after an accident, then the kidney is removed because of bleeding around that area, and that can bleed extensively. Those are actually common things that people, I'm sure, watching this show who have had that experience, unfortunately.
So what are some of the missed opportunities where a kidney failure could have been reversed, and looking at it from that particular angle, where an accident has occurred and, neither the doctor or the injured, the victim, knows if they might have, affected their kidney or whatnot. What are some of these missed opportunities? So
in the acute setting, normally those kinds of missed opportunities are unfortunately tragic, because you need to be aware as a clinical person. I want to believe that most healthcare workers are aware of this particular risk, but you must also have the resources to, one, test and confirm that this is what's happening, and then do the follow-up. So if I am in a setting where I cannot test for kidney function, the best I can do is maybe use surrogates. A surrogate is something I can use in place of the main thing, and assess, for example, urine output. If I'm able to measure that and I'm alive to that risk, then we can tell there could be a problem here and do something about it. But if you miss that opportunity, normally you can have a situation where the kidney dysfunction is prolonged and reversing it becomes difficult, and that's the best outcome. Because if you don't recognize acute kidney injury in an acute setting, you don't do it fast, the risks are often catastrophic. And again, these are not hypothetical examples, these are realities. People have actually lost their lives because of this kind of situation.
Now, as we get into, chronic kidney disease, you said 5 stages.
Yes.
Clearly, it's very different from, acute, because very little things, you can die with acute, right?
Yes.
But not to scare anyone. Let's get this call and then we come so that you can give us, some clarity on CKD, chronic kidney disease. Good morning, Joseph. Good morning. Do we have him? All right, we've lost him, unfortunately, but we're hoping you can call back, Joseph. Chronic kidney diseases, 5 stages. Talk to us about that.
Okay, so the 5 stages sort of are based on the level of function. So your normal kidneys are working at, say, 100%. Then as the percentage drops progressively, then we classify your kidney function. Now, I know you are keen on having the precise value, so I'll tell you what it is. So if you have what we can call kidney damage with normal function, the function is not affected, but there's some level of kidney damage. If you look at your kidneys, you take a biopsy, you'll see some damage, but the function is normal, then we say that is stage 5. Stage 1. It's the lowest stage, and there we talk about 90 mils. It's called GFR, glomerular filtration rate, how much the filters are producing, and we want it to be at 90 mils per minute per 1.7 meters squared. So don't worry about all those details. But anyway, 90.
We're
90,
in
so let's say 90.
class.
That's where you want it to be.
Yes.
So you're maintaining around 90 mLs per minute per all those things that we've discussed. Then the level below that, the output has dropped from 90 to 60. So it's between 60 and 90. It's above 90, you're happy. Between 60 and 90, that is stage 2. And then stage 3.
Just hold on to that. Stage 2. Joseph is back. Joseph, good morning. Joseph?
Yes.
Yes, talk to us.
Yeah, swali langu
Yes.
ninauliza kwamba mtu anastahili kukojoa mara ngapi na ni kwa nini makojoa huwa sometimes yanatoka akiwa na harufu?
All right.
Yes.
Thank you so much, Joseph, for that question. Daktari is here just for you.
Yeah.
Marangapi?
So Marangapi is sort of a tough question to answer because many factors. The only thing is that you want to ensure that you're passing out over 1.2, 1.5 liters of urine every day. This is really the Marangapi. That's a very nice question. I really need to be able to answer that particular one. But you need to put out 1.2, 1.5 liters of urine every single day. And the reason why you may have some scent in your urine that's unusual, one is if you have an infection, and 2, if you are dehydrated, you'll actually be able to tell. So drink lots of fluid and get urine out. And if you have a foul smell in urine, foul smell in particular, get checked. That means you may have to you may have an infection at some point. But most often the reason you have this concentrated dark urine is because you've not taken adequate fluids. So take adequate fluids, drink water. 8 glasses is recommended, 8 glasses per day, and your urine is going to be better. Now, when you're conscious that, say, for example, you're waking up in the night to go and pass urine, it's not normal to do that.
It's not normal? To
wake up
in the
no,
middle
if
of
you're
the night?
like a couple of times, like you wake up twice in the night to go and pass urine, is not, that's called, you're finding that you're actually, it's something that you should be concerned about. Check your sugar first, and then check your kidneys. So sugar is the first thing that you're checking in. Then there are other not kidney issues directly, but related, the prostate, especially for men, where these obstructive symptoms actually cause you to pass urine frequently. And so you have to be very careful about that as well. So for men, especially above age of 40, you not only have to check your sugar, you not only have to check your kidney, and the first thing is to check the protein in the urine, but also the prostate. because that can cause you to have this frequent urination and so on, while the kidneys are fine. And of course, if you don't sort out the prostate, it becomes enlarged, the kidney will complain down the line.
Evans, we already have you on call. Just hold on a little bit. But regarding that question that we had about how many times one should urinate in a day, you know, now we have people who will now want to suppress urine because you said 1.5 liters.
Yeah.
Shouldn't you just go to the, you know, to the loo when you feel the urge?
Sorry, I'm not saying that when you're passing urine once in one stream, no. I'm saying throughout the day you want to ensure that the volume, like you're not passing too little urine, you're not passing too much urine. Not the number of times. I wasn't talking about the number. The number, I may have to get back to you on that, but it's not, yeah.
When you feel the urge.
Yes, go pass.
Evans, all right. Evans, good morning. Evans is calling us from Busia. Evans? We've lost him. Evans, Jamani, so you said you don't run away. It's okay. So we were talking about stage 2, the chronic kidney disease. We already clarified on the acute kidney disease. Now, chronic kidney disease, stage 1 is done, stage 2 now.
Okay, so stage 2 is between 60 and 90 mLs, those many units.
Yeah.
Stage 3 actually has 2 levels. It's generally 30 to 60, but in between we have 30 to 45, then 46 to all those. But essentially you can see that the values are coming down. Then stage 3 is between 15 and 30, and then stage 4 is between 15 and 30, and stage 5 is below 15. So below 15 is what we call end-stage renal disease. At this level, you need a transplant, you need dialysis before you can get a transplant. Now, stage 1, 2, and 3, we generally don't talk of them as the severe ones. Stage 4 and 5, these are severe.
Hold on to that point. Evans is back. Evans, good morning.
Yes, good morning.
Yes, talk to us.
My question was having a backache in the morning, lower back, is it a sign of also a kidney problem?
All right. Lower back pain in the morning. He's very specific, not at night, not in the afternoon, in the morning. Is it a sign of kidney?
Not necessarily. That needs to be evaluated differently. Of course, your kidneys are somewhere near your back. It's not a common problem per se, although your kidneys have a role in bone health through calcium regulation and also converting vitamin D into its active form. Vitamin D is what makes your bones very strong and other functions as well. So in that way, you probably want to check your spine, have a doctor evaluate, especially if you're beyond a certain age. You may also want to see whether there's something going on with your back. But there's no harm regularly, every year, checking your kidney health by doing urine, checking how much protein there is in that urine, and also just taking a blood sample and checking the kidney functions as well.
All right, thank you so much for that question, Evans. Stages 1, 2, and 3 of chronic kidney disease are not as severe as stage 4 and 5.
Exactly. So you can see it's progressive. You start from normal function with damage, then to end stage. So 1 is normal function with damage. Stage 5 is end stage renal disease. So it's progressive. So depending on the stage, and I think the stage is also not something that you want to focus too much on in this way. Just where you are as a person, where is your kidney function, what does your doctor tell you, and how can you slow progression when you have kidney disease.
So how reliable are, screening tests? You talked about a urine test. Is it albumin?
Albumin.
Albumin.
You go, Daktari.
Albumin and, of course, EGFR. You clarify that for us. How effective are these tests? Because sometimes, we've had cases where some are misdiagnosed and then whatever you've gone there to be checked out for is not necessarily the results that you get back. So how reliable are these tests when you're testing for the health of your kidney?
The good thing is that kidney tests are very objective. There are things that we can say are a bit subjective in medicine, but kidney tests tend to be fairly objective. They it's a value. You measure a value, it gives you a natural number. So there are two things that you really want to pay attention to. One is to look at protein, especially in urine. And you can look at the big protein, which is macroalbuminuria, but there's a smaller test that we can do. It's called microalbuminuria. It's a small traces amounts of albumin in urine. And this can be done in good laboratories. It's not very expensive. but it's a very good indicator because once your kidneys start leaking protein, it tells you even before you get any other symptoms, even before your EGFR drops, you have this kind of value. It tells you there's a problem, you want to do something about it.
Let's talk about these people who are, at higher risk. Those with diabetes, hypertension, even the older people. We've had one caller who is approaching 16, also has concerns there. What are the recommended screening protocols for them? Or are they also going through the same procedure of urine, testing, albumin and all that? Just hold on to that.
Okay.
We're coming back to answer that question, but let's get this call. Director, remind me. Ben, good morning. Ben? Do we have him? Ben, call us back. Don't run away. We'll be happy to hear from you as you contribute to the conversation. So what else can be done to these people who are at higher risk, those with diabetes, hypertension, and older people? So
do you know why 90% of people with kidney failure don't know they have kidney failure? Because you don't have a culture of routine examination. So I'll start with you and I. And the recommendation would have is that at least once every 2 years, get checked. Just walk into all these places where we have packages to check your kidneys and so on, kidney function. Just have that test done, and you'll have a decent idea where you are. Now, for those who are at risk in particular, and you've highlighted the two most important ones, diabetes and hypertension. They should be in a chronic disease management program that requires that every so often they must do in particular, microalbumin in urine. This is something they really have to check routinely. And then they need to check their pressures and control these two parameters and also their sugar, and also have regular kidney function checks. And if the results are normal, we are checking things like creatinine, things like urea, but creatinine in particular, to estimate your filtration rate. Then you'll be given a schedule, either once a year or once every 2 years, depending on where you are. And don't skip this, because if you pick it early, remember that it takes 10 years from the onset of kidney damage to symptoms. It means you have a lot of time to pick it up and slow progression. Something like blood pressure is primarily harmful when the pressure is not controlled. So knowing that you can control your pressure and almost eliminate the risk of progression to kidney disease gives you the kind of power that knowledge gives. All right. Beatrice is calling us live from Kericho. Beatrice, good morning.
Morning, madam.
Yes, talk to us, Beatrice.
I want to ask daktari.
Yes.
Sahili uko na diabetes. Sahili unaamka asubuhi unakuwa unachoka na utakuwa na diabetes, na watu wanasemanga Edidex, natoka nyumbani lakini hakuna mwenye ako nayo nyumbani.
All right. She's also very specific. Unaamka asubuhi kama umechoka and you have diabetes. Yeah.
So remember this, kuamka asubuhi ukiwa umechoka ni jambo la kukupatia wasiwasi kidogo, haswa kama hapo mbeleni umekuwa unajihisi kuna nguvu ya kutosha. So two things you want to do, because diabetes in itself can cause you to have this kind of sense of fatigue and also symptoms of kidney disease. Remember I mentioned this one, you begin to have fatigue as well.
Right.
So ukiwa kuna ugonjwa wa sukari na unahisi kwamba umechoka asubuhi, hakikisha kwamba sukari yako is well controlled. And the way to do it, there's a test called HbA1c, which you can do, and also just a regular monitoring of your sugars. HbA1c will tell you if your sugar is well controlled over a period of about 3 months. And you want to have that within normal values. Have your sugars well controlled. At the same time, it's very easy to focus on the diabetes and forget all these other organs, especially the kidney. So mom, na kuhisi kwamba hakikisha kwamba kila mwaka mara 2 kwa mwaka unaangalia figo iko namna gani, unaangalia macho iko namna gani, kwa maana na moyo iko namna gani ukiwa na ugonjwa wa kisukari. Kwa maana sehemu hizi zote zinaadhiriwa na ugonjwa wa kisukari. What I'm saying is, if you have diabetes every year, it's very easy to focus on the sugar and you think that's it. No. High sugars will affect your kidneys, will affect your eyes, will affect your blood vessels, will affect your heart. So every year, and in fact, I'm recommending twice a year for those with diabetes, have your kidneys checked, have your eyes checked, have your heart checked to maintain a good health and control your sugar.
What's in the eye that should be checked? Is it the color? Sometimes, you know, they say when I look at your eye or in your eye and then I see some yellowing, then that should be cause for alarm. Then what's in the eye that should be?
Yellowing is cause for alarm, but that's not what you're looking for in this situation. So when light hits your eye, it gets to the back. There's the sensors. It's in a place called the retina. And so diabetes and hypertension will affect the retina. So the specialist will look at the retina in particular, looking for what we call diabetic retinopathy. Big words, but basically it's saying that damage to the retina, which is the sensors at the back of the eye, as a result of elevated sugar and or a hypertensive retinopathy. So an eye doctor, ophthalmologist, again, you can get that where we are. They'll check your eye and tell you whether there's a problem or not.
All right.
And you want to track this, by the way, because diabetes is surprisingly a cause of blindness as well. Yeah, so if you address it early, there's a lot that can be done to reduce progression and also avoid that kind of preventable blindness.
All right. Now let's talk about treatment options for kidney disease, because I know a lot of people have been waiting for this part.
Yes.
We've now talked about causes, symptoms, what you should look out for, but now treatment options for chronic kidney disease.
Yeah, so the first thing that you want to do is to remove the cause of injury. So if, say, you like Brufen, you follow someone who recommends Brufen all the time, she's funny, but stop that. You know, if there's something that you've been doing that affects your kidneys, you want to reduce. If you've heard me speak about smoking, you think that smoking is fine. No, it's not. You stop those kinds of things. You stop excessive drinking and so on. If you have an underlying disease that is contributing to your kidney disease, then you have that controlled. We've spoken about diabetes, get it controlled, high blood pressure, get it controlled. Those are the two main causes. And if you have another infection, have it treated as well, or managed to the best ability. Then the next thing that you'll want to do is to make modifications to things like your diet so that you can reduce the load on the kidneys. So two that I'm going to highlight, one is protein, and the second one is a certain, what do you call them, the electrolytes like potassium. So when you have kidney disease, then your body doesn't handle protein so well, so you want to reduce your nyama choma and everything else. It doesn't handle potassium very well, things like potassium and so on. Potassium is in avocado, it's in bananas, lots of fruits. Incidentally, these things are very good for you before you get kidney disease. If you don't want to get kidney disease, you want to take a lot of fruits, take your avocados, they're fantastic. But once you have kidney disease, you reduce that as well. Now, many people will not need any kind of therapy kidney-wise until they get into later stages, normally stage 5, where they need some form of dialysis and so on. So at this level, there are a number of things you may have to do. We may have to look at your blood level and replace your hormones like erythropoietin. We may have to give you additional vitamin D, but we may also have to put you on dialysis if you need to be on dialysis. So dialysis would remove all this waste that the body can't remove the extra fluid the body is not able to remove. And of course, the closest to cure for end-stage kidney disease is transplant, to get a transplant. That would be the best way for such a patient. And in between, there are a few other therapies that can be done, managing symptoms and so on. All these are available as long as you're working closely with your doctor.
All right. And when you talk about transplant, this surgery, if say one is removed, can it cause failure or future risks to, especially to the donor? Because I was having this conversation with somebody, and their concern was, Mungu amekupatia kidneys mbili for a reason, and if you remove one, then the remaining one will not necessarily perform its functions as it should. Then what risks does removing a functional kidney from a donor have in the long term?
I don't want to say there is zero risk, but that's not true. I'll give this example, and again, these are real things we have seen. Someone is in a road accident, and the one kidney gets crushed, because it's very common actually, because it's very close at the back. So the doctor have to remove one kidney, and you're left with one. Okay, well, that one kidney will work perfectly. So the risk to the donor is that if you in an accident, for example, and the only kidney you have is crushed, then you don't have the second one. But if something like this doesn't happen, then donors actually live fulfilling lives. They, would not be taking out your kidneys. Of course, you'd rather have two if you had that option, but if you had one, it's perfectly fine. And the person you're giving one kidney will only have one as well. The body is quite resilient in this way, and one kidney is enough for you to, as long as it's healthy, take good care of it, avoid all this toxins you've spoken about. I also know that in the process of transplant, we actually take the donors and the patients through rigorous evaluation so that we check your health, the risks you have, including certain factors that may put you at risk in future before that donation is accepted. Yeah.
How common is a kidney transplant in the country?
Unfortunately, so we have capacity. And this is one area where the government institutions are doing a better job than private institutions. I think Moi Teaching and Referral Hospital has been leading in kidney matters for the longest time. Kudos to them. And transplant is available. It can be done in many, many facilities across this country. But then the issue, of course, is access to that, because it's not only you need to be ready, you need to have a donor. And then there's what is called post-transplant care. That's super expensive. So there's a lot of conversations there, and then taking care of the kidney thereafter. So in terms of science, in terms of availability, as a country, we've done very well. I think we should be proud of ourselves. But then it's very challenging because you need someone to give you a kidney. There's a lot of investigations around it. It's expensive. And then after that, there's almost lifelong care. But in terms of almost curing the disease, transplant is the way to go.
Are there more donors in this country? Is there enough awareness around, kidney transplant, especially to donors, now that they need to be taken through counseling and everything they need to know? Are we having more people offering to donate their kidneys?
I wouldn't say. I think there's still a challenge getting people offering to donate, and for many reasons, including lack of awareness, lack of education, and generally fear as well. All these factors contribute, and there are many people who would like to require kidneys, but they take a long time. So, and it's not just about someone being willing. You may be willing, but you must match. There are certain genetic tests that you're going to do to see if this kidney is likely to take or is likely to be rejected. So you can have lots of people who are willing, but they can't donate to you, and you not donate to everybody. You cannot donate to certain people. So those kinds of situations make it still a bit challenging to get kidneys. In the West, there are options they've given. Say someone who's on, who's, say for example, brain dead, they can donate the organs to be used. In Kenya, we don't have those kinds of options. So we are not there. We are not there yet.
Yeah. All right. You remember Joseph, who called in live from Juja? He's back on call. Joseph? Yes. Tuongeleshe.
Okay. My question is,
yes.
When I deny myself sex for a long time, I feel my kidneys paining. But when I perform that, the pain goes.
All right. That's interesting. Joseph anasema when they engage in coitus, he doesn't feel any pain.
So he feels his kidneys paining. Joseph, it's very hard to tell that your kidneys are paining.
That's so surprising.
No, it's probably you need to find out what exactly is going on.
Yeah.
Because you really can't tell it's my kidney unless you've had a problem with your kidneys before and something has been done. Say, for example, you undergo a procedure and you have that pain at that particular place. It's very unlikely to be the case. And I'll leave it at that, although there is, I'll leave it at that. Prostate-wise, there's a conversation there, but kidney-wise, no. The kidneys are not really in that equation. That one is a different story. Please, if you're having some pain, Joseph, please see a doctor. Yeah, just come and have a one-on-one conversation. Let's see what's going on. Why are you having pain? And don't ignore pain and don't attribute it to your kidneys, because about 95% sure it's not your kidneys that's paining at that particular time.
It could be something else.
Could be something else.
Right.
Yeah, and it could actually be that your back is paining because of stiffness and other things. I'll leave it at that.
I think that is a very great concern, because I saw a similar question on X when I was scrolling. Somebody was saying too much of it could also cause kidney failure or disease.
Yeah, so can I give that a bath, take a wide bath on that one? Yeah, so we
will pause on that.
We will pause on that. I'll plead the fifth on this one, yeah.
All right, we were talking about the accessibility of transplant options in the country, and if donors are aware of what's in store for them in the long run. But now, how accessible is dialysis centers in this country, and especially for people who have chronic kidney diseases in the far-flung areas, say places where medical facilities are almost non-existent?
I must say that we've done very well. And first of all, by the way, in terms of donor education, I think there's a lot of people who are doing that now. So kudos again, we have to give credit to its due. That has gone a long way now. It's available. People can be counseled, and it's built into these programs for transplant. But when you talk about availability of dialysis, I have some PTSD. I did my internship in Kenyatta back in 2007. And back then, if you had kidney disease, we found kidney disease in the ward, it's a very sad situation, because we'd ask you if you could afford to spend 60,000 every month for the rest of your life. And if you couldn't afford it, we'd tell you, please don't start. Because what used to happen is that someone would go and sell his 3 shambas, he'll probably earn 600,000, and he can do dialysis for 10 months. And then he can't access dialysis anymore. And he passes away and leaves everybody behind him destitute. People would sell everything. That's what it used to be like. And dialysis used to be only in a place like Kenyatta and a few other places, just a few centers. And so one of the biggest milestones in dialysis access was NHIF. I know it's now we're talking about SHA, but NHIF is what changed this, because at some point, by God's grace, NHIF started covering dialysis. They were paying 9,500 for dialysis, and that's been a life changer. What that did, it allowed many centers to come up. Still not nearly enough, but many centers came up in different areas, and suddenly counties that never knew of dialysis now had access. And SHA has actually improved that access. I'm not talking about whether it's working or not. I'm just describing dialysis in particular. It has increased the amount of money being allocated to dialysis, and that allows more people to do dialysis in different centers. Of course, whether they're paying those facilities or not is a different conversation. But if it were to work as scheduled, then it would continue what NHIF started, which is to allow people to invest in dialysis centers. You think of it this way: you need dialysis 2 to 3 times in a week, and it's between up to 4 hours. So you really need to have dialysis walking distance from your home. So can you imagine that in our lifetime we've had patients having to travel from, say, Hologo, which is 400, to Nairobi for dialysis. People would wake up by 3, they're waiting. So building the dialysis infrastructure and structure around people's lives is what we must do as a country. It's our responsibility as a people. And it's easy to set up, it's supported. And if we can fund it, which is what we are saying SHA should be able to do, then we should be able to make rapid progress. Of course, I hear many centers saying they've not been paid, and that can, of course, reduce the incentive for people to get into this space. We don't have enough healthcare workers, trained nurses. Nurses are absolutely critical in dialysis. So there's a lot we can do actually within existing resources. Don't get me into that one, because there's a lot we can do to make it easier. If you have kidney failure, you need dialysis. Within 20 minutes of where you are, or 30 minutes, you should be able to get a dialysis center. Then you decide, I'm going to go in the morning at 6, by 8 I'm going to work, life continues, honky-dory. All right, and Dr. chronic kidney disease is not kidney failure, right? So we have, okay, there are different terms, but they refer similarly to the same things. Kidney failure is acute or chronic, but chronic, literally, they're the two, well, different terminologies, but for different reasons, very small differences in between. But for the purpose of this conversation, I want you to hear it the same way. There's acute kidney failure and chronic kidney failure. I want you to look at it in that setup. The rest of it are details that we're not going to get into. Yes. We have come to the end of this conversation, but I would love for you to give us a parting shot, what we should do and what we should not do just to protect our kidneys. First and foremost, as a country, we don't get tested enough. Please get into the habit of doing regular checks. This is what promotes lack of awareness. Secondly, there are things you can control in life. They look very nice, they look happy. You know, the devil comes looking all dandy. Don't smoke, don't drink excessively. Be careful about what you take. Don't treat yourself, and don't take too many painkillers. You know, drink adequate amounts of water, eat healthy, and take care of yourself. Your kidneys are very valuable. You'll miss them when they're gone, and you don't want, if you can avoid it, go ahead. And the process of losing your kidneys is very slow, but irreversible. All right. Thank you so much, Dr. Victor Ng'ani. That is Medical Director, Dr. Rasik Kantari at Jalaram Medical Services. Thank you for making time. Thank you. Happy New Year once again. To you as well, and I'll tell you the same next month.
Enjoy. All right, we've come to the end of this conversation. The lecturer was speaking to us about kidney failure, what you should do and what you should not do with regard to protecting the health of your kidney. My name is Anne Odida. Good morning.